Hello and welcome to this month's edition of Hospital Rounds. I'm Kyle Schwartz and my guest today is Dr. Kimberly Jackson, and she's from the Alliance Community Medical Foundation, and we're going to be finding out a little bit about her, and then we're going to be finding out a lot about fibromyalgia. So welcome to our program, Dr. Jackson.
Thank you for having me.
And welcome to our community. So we're going to start with talking a little bit about your background. Where did you grow up?
I grew up in Los Angeles, California.
We were a long way from home.
Yes, I am. I've adjusted to the snow. That was a challenge.
All right. So where did you go to medical school?
I went to medical school at Ohio University, College of Osteopathic Medicine in Athens, Ohio.
Mm-hmm. And so why did you choose Ohio University School if you were from Los Angeles?
Well, I chose it because it provided a more holistic approach to medicine. I'm a DO, so I'm an osteopathic doctor, and so we also use our hands to do treatments on muscles and bones and other tissues to help the body to heal itself. And that's called osteopathic manipulation.
And that's something that Ohio University School offered as opposed to some other...
Yes, that's additional training that we receive.
Plus, didn't you love Athens?
Oh, yes, Athens is beautiful.
It is a pretty campus.
Yes.
All right, so after medical school, where'd you do your residency?
I did my residency at St. Joseph Health Center in Warren, Ohio, and our sister campus, St. Elizabeth Health Center in Youngstown.
So what brought you then to Alliance Community Hospital?
Well, it's such a nice hospital, and they offered me a job, and I accepted happily. And I just really like the community here, the area, and my husband is from Canton, Ohio.
Oh, okay. So you are kind of back home then with him. I mean, he is back home. Okay. All right. So you recently gave a seminar at Damascus Friends Church, I think, about fibromyalgia, and it looks like there was a very big crowd there. Apparently, a lot of people need to know more about this disease. So what is fibromyalgia?
Fibromyalgia is a muscle disease, and the most common symptom that everyone has with fibromyalgia is muscle aches and pains. And unfortunately, there's no blood test for fibromyalgia. And a lot of people think, oh, I'm just getting older, it's my muscles, my bones are aching. But there's a lot of other symptoms involved. And the most common is the muscle aches and pains, but also fatigue, just feeling really tired. The most common complaint that I hear from patients is, my get up and go has gotten up and left. And so that's the biggest issue that we see. And often depression too, because people aren't able to be as active as they used to be, or it's painful to pick up their grandchild, or it's painful to cook or do different things around the house that they are used to doing. And so then they're not as active. They just choose to kind of lay around because it's more comfortable to do that.
And you've mentioned a couple things that make me think this is a disease that strikes primarily women and primarily like over 50. Is there an age range?
Yes, absolutely. 80% of people affected with fibromyalgia are women. So it definitely affects women more than men. And then it can be any age from the mid-30s all the way up to the 50s and 60s, but more common in the 50s.
All right. So once you get it, does it tend to be progressive? Does it get worse, or does it stay the same? Can it go away?
It can get worse. It can go away with treatments. Unfortunately, there is no cure for fibromyalgia. Just treating the symptoms of the muscle aches and pains with muscle relaxers, massage therapy, or manipulation, as I mentioned earlier. So those would be the treatments.
All right. So if a patient comes in complaining of some of these symptoms and there is no test, then how do you determine that that is truly what it is?
A lot of times it's what's called a diagnosis of exclusion, meaning that you can do blood tests for thyroid disease. So if people are feeling very tired all the time, they're having muscle aches and pains, their doctor may order a panel for arthritis to check a rheumatoid factor, or an ANA to check for lupus and other autoimmune disorders. And then a lot of times those tests will be negative. Nothing will come up of it. And so then you start to think, well, maybe this is fibromyalgia. It's not usually the first thing that comes to mind for this type of, for the symptoms of the muscle aches and pains and fatigue. A lot of time blood tests are checked for a CBC, which is a complete blood count, to check for anemia or a low blood count, which would account for the fatigue and things like that. And then after that, when those tests are negative, then physicians will check the patient's body for different tender points in the neck and shoulder area, in the back, the hips, and also the knees. And so those areas, if those are tender points, meaning they're tender when you push on them, because sometimes you can push and it doesn't hurt at all. But if you're really tender and the patient is jumping up and they're like, oh, don't touch me, that really hurts. And if they have 11 locations, specific locations where it's very tender, then you can have the diagnosis of fibromyalgia.
Okay. Is there a lot of research being done? Do you think there's going to be a treatment soon other than what we're using right now?
Yes, there's a lot of research being done through the rheumatoid associations. So the same physicians that treat rheumatoid arthritis, and we've seen the commercials with the golfer who has psoriatic arthritis and things like that. They're also doing a lot of research on fibromyalgia because it's considered in the same class of disease.
Okay. And it does seem like in the last 10 years it's become a more well-known disease. I mean, it seems like years ago it just seemed like a lot of people just thought, oh, it's just women complaining, right? I mean, that's what people would say, right? If you couldn't put a name on it and you couldn't, that, right? So it's become
Absolutely, and it's unfortunate that some people were even felt to think that they were crazy. Mm-hmm. Oh, there's nothing wrong with you, just suck it up, you'll be fine. Or, oh, you're just getting older. But there really is actually a diagnosis. There is a name to put over that. The FDA has approved several medications to treat fibromyalgia. One of those is called Savella, and there's other medications for nerve pain, such as Lyrica or gabapentin as well, and those are medications that can also treat fibromyalgia.
Okay. So if you're treating a person, though, with massage and that type of thing, how many treatments does that usually take?
It varies from person to person depending on how much pain they have and what their activities of daily living are. So if they're very active, and it varies from person to person how much exercise they get, or if they're a caregiver for one of their parents or their children, and how much they're getting up and moving. And so it does vary, but usually twice a week or so. Okay. Some people require more treatments.
Okay. And is there is there a particular reason why you were interested in fibromyalgia? Is there somebody that you know that has it, or you just...
I see a lot of patients with fibromyalgia. It's one of those things where I've seen people progress and a lot of frustration for patients. Why hasn't this been diagnosed sooner? Or why did it take this long for us to figure out what was going on? And so I think because I've had that experience with my patients, really just wanting to get the word out that as a physician, we recognize that this is a diagnosis. We know of some of the testing that can be done to rule out fibromyalgia as a diagnosis or even rule it in through doing a physical exam and getting history from the patient, and that we're here to help, and that, we really want, as doctors in general, we want the patients to feel comfortable talking to their doctors about these things.
All right. So fibromyalgia is just one thing that you treat because you're a family practitioner. Why did you choose family practitioner as opposed to like a specialist in some area?
Well, I like a little bit of everything, and I like to treat children, women, and men. And I really feel like I'm doing a service for the community, especially when my mom calls and says, oh, when do I need to have my colonoscopy done? And I don't have to say, well, I only work on this particular area. So I don't know that. I can't help you with that. Yeah. But as a family doctor, we do a lot of preventative medicine. We do health for the entire body, for the entire family, and I just love it.
Okay. All right. Well, was there anything else that you wanted to add before we close our show?
No, you can come and see us over at Alliance Community Medical Foundation.
Okay. And how many doctors are in the practice that you're in?
There are 5 physicians in the practice.
Okay. All right. Well, thank you, Dr. Jackson, and welcome to our community, and welcome to the hospital.
Thank you.
And thank you for being a part of our show, and thank you for watching Hospital Rounds. I'm Kyle Schwartz.